Hi, this is Bob Lightfoot coming to you once again from the offices of Reinhardt, Berner, Van Duren here in Madison, Wisconsin. Giving you an update today, which is March 19th, of a webinar that DHS Wisconsin put on today. And it basically was a question and answer period from questions that were submitted to DHS that were answered by Otis Woods, Alfred Johnson, Kiva from the DMS division, and one of the state physicians, Dr. Chris Cernich. So I'm going to go through what they talked about today in case you missed that DHS webinar from today, and hit the highlights for you of that. Not going to go through everything, but we'll hit the highlights. It was an hour and a half, so I'm trying to condense this down into about 15 minutes for you. First of all, symptomatic workers should be excluded from your facilities, nursing home and assisted living. And this was directed primarily today to nursing homes and assisted living facilities. They are at the highest risk of transmission when someone is symptomatic. Asymptomatic people can shed the virus, and as a group here at Reinhardt, we've been discussing what to do with those employees who've been exposed but do not show symptoms. So exposed but asymptomatic. And I think what we're going to advise you is that in those situations, they can come to work, but it would be best if they didn't come to work. But I know that your staffing levels in many instances are not going to support that, and they may have to come to work. So my advice would be to try and get them a face mask if they have been exposed to coronavirus but do not show symptoms of coronavirus. Obviously, if they do show symptoms while at work, the advice is to immediately have them put on a face mask and leave the job site immediately. All non-essential personnel should be suspended from the facility, and that means people who aren't essential. That question did come up with regard to hospice again, and it was the opinion of Ann Angel from the Bureau of Nursing Home Services that hospice should be allowed in the facility if they are working pursuant to a care plan, and that would lead me to then conclude that if they're not doing anything essential, that they probably should be excluded. But if they are working pursuant to one of their hospice care plans, that they should be permitted in the facility. Right now, all non-essential survey activities are being suspended. So that includes everything from recertification to revisits. The only time they will be coming in the facility is with immediate jeopardy or when they determine there's harm to particular residents. In addition, the 1135 waivers are something that should be looked at for federally certified providers. These mostly will be nursing homes, obviously, and the areas they're looking at are waiving requirements for MDS right now and the 3-day prior hospital stay. So that's important. On the assisted living side, they did encourage facilities on an individual case-by-case basis. If they need a state waiver for any requirements in assisted living, I'm thinking primarily of training if you're bringing in new employees, certain types of training. There are probably certain types of training that are critical, but maybe to get people on the floor more quickly. I know we've also been discussing about the pre-employment TB test, whether that could be waived. It's worth a shot if you do need to get people in the facility. A question arose in nursing homes about medical directors not wishing to come to nursing homes during this outbreak, and both the state physician and Ann Angel were pretty clear about this. There's no reason they shouldn't be coming. In fact, the state physician that was on the call said that if they refuse to come, that may be something you should consider of turning them into the state medical board for refusing to come in and providing care. Other things you may look at is, can they provide any kind of cross coverage? Telehealth, is there a locum tenens physician that could take the place? But the state physician did believe it would be unethical for medical directors not to be participating in the care of nursing home residents at this time, even with the pandemic. Non-essential nurse practitioner or MD visits, physician visits, however, can be postponed if they're not critical in the moment. There's no critical need for that visit. They can be suspended. In terms of vital signs, the recommendation continues to be once every shift for inpatient residents, especially temperatures, important. There was a question how long residents should be in isolation if they have respiratory symptoms. The recommendation's 14 days in isolation. That's the same recommendation if your care workers are symptomatic. Again, employees should be screened every shift when coming in, especially temperature. What about residents ambulating in the hallways? Is that okay? If they're asymptomatic, it's certainly okay. They should be pretty much doing their normal routines except for some of the dining experiences. If they are symptomatic, they probably should be confined to the room. But if they're not, if they're asymptomatic, it's okay for them to be up and around the facility. Just make sure you're implementing the social distancing. There is a screening tool for long-term care that can be used. It's on the CDC website. What about volunteers? Okay to exclude them. If you really need the volunteers, make sure that they understand the risk that they will face if they come into the facility. And of course, they have to be appropriately screened like any visitor would be, except visitors right now are pretty much prohibited from being in the residence. And ombudsmen are available if you need them to consult with residents or with visitors, so that visitors understand that they simply cannot be visiting their loved one except under certain severe circumstances like end of life, or if it is a psychosocial determined support need of some sort. But the state ombudsman program, if you reference that and look at that, Google that online for Wisconsin, they can assist in those conversations. Can facilities confine residents? No, not if they're asymptomatic. But you want to make sure you do the social distancing. Don't group them in close proximity. And the guidance is not to keep everyone in their rooms at this point, even though that may be tempting. What about transferring residents for testing if they become symptomatic? You have to treat that like you would the flu or any other clinical symptom. This was discussed by CDC yesterday, that you'd only transfer them for testing if that could not be done at your bedside and if they were symptomatic to the point where they exceeded the care that you can provide them. So a nursing home can perform the nasopharyngeal swab that's required for testing for coronavirus. But again, it may depend on the capacity of your lab. Check with your lab to see if they are equipped to be able to handle testing. That may be another instance where you may need to send a resident out simply because you can't perform the testing at your facility. Likely, assisted living facilities are going to have a reduced ability to do the testing. So again, talk to your lab that you've contracted with and see if they can offer you any suggestions for doing the testing at the bedside, even in an assisted living facility. But that could be something that you've never done before, and you may have to make alternative arrangements and possible transfer just to obtain the testing at that point. Let's go over visitation and family visitation briefly once again. They're not able to visit at this time. That's the national guidance, and that's our state guidance right now from Wisconsin DHS. You really should exclude non-essential visitors. This could be a case-by-case basis, though, like I said, for psychosocial care that's needed or end-of-life situations. You should not have multiple visitors at the same time. Those visitors should go directly to the room if they are admitted, and they should go directly once they are finished to the door to leave the facility, and their stay should be shortened as much as possible. Be sure to offer FaceTime, internet, any other kind of visitation through electronic means that you're able to accomplish. Question came up is if a visitor just simply has a runny nose, should they be excluded? And the answer to that is yes. Runny nose is and can be a symptom of coronavirus of an early onset, so those people should be excluded. In terms of adult daycare, that kind of falls under the Assisted Living, Bureau of Assisted Living. DHS is seeking clarification based on the governor's order yesterday about restrictions with regard to child care. He did not mention anything about adult daycare, so DHS is seeking additional clarification on that. You may want to check back with the Wisconsin DHS website on that. With regard to dining, that is still restricted, so keep social distancing in mind for that. In terms of delivery of supplies, the main thing there is just the surface cleaning. Make sure all surfaces are cleaned. There is a CDC link on the CDC website to appropriate commercial cleaners that can be used for that. And CDC did say yesterday in their presentation that to the extent any supplies can be left at the door or on a loading dock and not make their way directly into the facility through common areas, that would be preferable. Then there was a question on handmade masks. Can they use those? The DHS stopped short of recommending that because there has not been any testing on that, although I have recently seen nationally that there has been some approval, I believe through CMS, that scarves can be used as masks in place of a regular face mask, but you'll want to check the guidance on that. I'm going to talk about the PPE guidance that just came out a little bit later. We're running short on time. It's already going on 2 p.m. and that deadline is 4:30 p.m. today. I'll talk about that at the end. In terms of assessments, especially assisted living assessments, you can keep doing those assessments as needed, the scheduled assessments and the regular admission assessments, but keep precautions in place as much as possible. So the assisted living really has to follow the nursing home guidance at this point because there is no separate guidance for assisted living facilities. So it's everything we've talked about, the hand hygiene, the training of the staff, the symptoms to exclude people, both visitors and when to send staff home, the social distancing, and you probably should be using the toolkits from the CDC website. American Medical Directors Association does have tools and resources on their website. If you can find those, you can adapt those to assisted living as well. Then there was a question about whether or not facilities should be accepting new admissions. At this point, there is no reason not to accept new admissions, so you can accept new admissions as you would in the normal course. However, be sure that you're accomplishing any pre-admission assessments, if possible, by phone. If you are doing those in person, exercise appropriate caution when doing the assessments. Again, you may want to look at some of these MDS and other waivers in terms of assessments to see if that could be waived, if that's important to your nursing facility, to waive any possible MDS assessments that may be required in terms of timing of those or even of the assessment itself. Then there was a question, can you care for sick? Can a staff care for both sick and well patients simultaneously at the same time? DHS stopped short of giving a definitive answer. Ideally, you would like to separate staff that are taking care of sick patients and those that are taking care of well patients, but that can't always be accomplished. So the best you can do is segregate as much as possible, but take the necessary steps. Here again, PPE is going to come into play, both appropriate donning and they call it doffing, which is taking off the PPE. Make sure that is being followed, because most facilities are not going to be able to cohort staff individually and assign them strictly to sick or non-sick residents in your facilities. So for PPE, here's the latest. The latest is that there is a supply from the national stockpile that is available. It's being sent to Wisconsin. It is out of date, but it's been approved for use. It consists of N95 masks, gowns, gloves, face shields. There is a link on the DHS website. I'm also going to show you that link right now. You do have to apply for it before 4:30 p.m. today, March 19th. There are criteria attached to that. You do have to take a survey, and you're going to have to pass all criteria in order to be considered for being able to access this PPE from the national stockpile. So to end my update for today, here is the website. It's the STARD website right here, the second link down, and that is the website to use for accessing the PPE. And you could also go to my Twitter page, which is @BobLightfoot, to access that, or my LinkedIn page as well has that on, and we're going to try and throw that up on the Reinhardt Coronavirus Resource Center as well. So thank you for listening today, and as always, I'll be providing additional updates as they become available. Thank you.